Explained by Dr. Klos.
When is limping an emergency and when is it not?
Yeah, that's a great question. So limping is typically considered an emergency if the patient is non-weight bearing, meaning they're not putting any weight on the affected limb or maybe even just very, very little. We call that toe touching lameness. Other reasons would be severe pain. So if the dog is crying, whining, or possibly even being aggressive if you go near the area. Obviously, if there is bleeding or visible swelling or a deformity, that's another reason for it to be an emergency. The cause, and so if it's sudden and acute, that's typically worse. And or if it's associated with, a known injury like getting hit by a car, obviously there's other things to check for and reasons to bring them in. And then a few other ones can be other associated signs. So some types of limping can be due to infectious or immune diseases, and typically those dogs have other symptoms, fever, severe lethargy, or an appetite. And then typically if it's not an emergency, it's something that's a little bit more gradual onset, maybe something that you're noticing happening here or there, but some days better, other days a little bit worse. And otherwise, the dog's doing well. That's, I think, the biggest part. So like they're eating, drinking, they don't seem super in pain, but you notice they're walking a little bit funny. Those typically aren't emergencies and something you have to go to the ER for, but definitely something to get scheduled and get to the vet for that reason.